Welcome to another episode of The Brand Called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from hundreds of successful individuals from around the world. I'm your host, Ashutosh Garg, and today I'm delighted to welcome a very, very accomplished medical professional turned entrepreneur, Dr. Shyam Vasudeva Rao from Bangalore, India. Dr. Rao, welcome to the show.
Thank you, Ashutosh.
Dr. Rao is the managing director of Renalyx Health Systems Private Limited. He's also the founder and director of Forus Health Private Limited. He's worked with TCS, Ericsson, and Philips in the past, and he's been awarded, recognized, and felicitated several times. So, Dr. Rao, let's start talking about Renalyx. Tell me about this venture and your motivation to start.
Renalyx is as the name says, it is a renal care company.
Mm-hmm.
So we are basically into end-to-end kidney care.
Okay.
See, kidney is one organ which is one of the most robust organs among all the other ones. But then it's also the problem, when you have something which is very robust, you try to sort of take things for granted.
Correct.
And you neglect it. And with all the problems what we see in the day-to-day world, we are into such a pollution in everything. And everything, the kidney is the one which actually takes the burden.
Okay.
So what we are seeing is that we see people, getting chronic kidney disease. And as I was telling you, it is very robust. It doesn't actually, it is asymptomatic. And that is why we only notice it at the very end stage. So in Renalyx, what we are doing is, it's a first of its kind. The approach what we are taking is that why don't we prevent people from getting the chronic kidney disease, and also if they have this, if we can detect that in the early stages, can we extend the life of the kidney by giving them disease management support and all that.
Amazing.
And unfortunately, for those who get into the end stage, they also need something, for dialysis, which actually, is what we are trying to provide them at their.
I understand. But Dr. Rao, before going any further, for our young viewers and listeners, as maybe old ones also, tell me, what is the role of the kidney in the human body and what can create problems for our kidneys?
Well, kidney is the main filter of our body. We consume a lot of food. Not everything is digestible. So there are so many things like urea, uric acid, and so many other things, salts, which are not digestible, which actually the kidney will filter it out. So at the same time, kidney is also something which produces so many hormones, which actually help the heart for its proper functioning. So that way, the kidney is one. It actually takes all the dirty stuff, throws it out, creates some things which are basically giving you the strength, to the heart to basically function in the normal.
Amazing. And, a few minutes ago, you also said that we tend, because it's such a hardy organ, we tend to take it for granted.
Right.
I wanted to get again from you, what are the things that create problems for our kidneys?
Yes. See, things like our NCDs, we say, the non-communicable diseases, like diabetes, hypertension. These are the ones, which actually affect the kidney, and they start to, create a problem for the kidney, which will actually, the nephrons, which are the basic part of the kidney, starts failing. And the proteins, which are supposed to be retained in the body, will also start getting out of the body. So that is the thing. So
wonderful.
That is
Thank you. Thank you for sharing this with us. So, coming back to Renalyx, your vision, Dr. Rao, is to create innovative and inclusive solutions for comprehensive renal care.
Right.
Help me understand what you do for people who have renal problems.
Yes. As I was telling you, first of all, the non-communicable diseases, diabetes, hypertension, when they set in, people are not aware that, this can also have an impact on the kidney. Like it's a multi-organ problem actually. Diabetes is the mother of all the diseases.
Correct.
So we provide a mechanism, a simple mobile app and a sort of a dipstick through which, they can do a test at home, or health workers can do it, and anyone can do this. It's a simple dipstick test, which will actually give them an indication that, well, your kidney is fine, or you already have kidney problems in the early stage or in the late stage. So this sort of a semi-quantitative test, is what we have devised. Okay. So we have a patented technology actually. We've already patented granted in the US for us. Okay. And with that, we are in a position to detect this problem at an early stage. Then, once we know that there is a problem, then people want to know how to manage it. You see, in India, we have more than 130 million people, who are either diabetic or pre-diabetic. Wow. If everyone wants to get a nephrologist support, it is impossible. Correct. So we are putting an intelligent companion app, we would say, which will actually help them in telling them what are the do's, don'ts, when they have to go for the next checkup, where they can go for the next checkup. All these sort of things, are there in this beautiful app. And that is the second part of the thing, which is called care. Okay. And then, see, a lot of them, as I was telling you, it is not possible to, if it is asymptomatic, they don't even get to know that they have a problem. Correct. So, for those, who end up at the end stage, the only two options is either they have to get a transplant or they have to go for a dialysis. Wow. So, transplant as such, is a very, some process, not a easy stuff. Getting donors, all that is a problem. Whereas dialysis is the only viable option for them. But then dialysis, it is like, every alternate day they have to go for this. So we have made a machine which actually has capabilities where, we can put this into the tier 2, tier 3, and also, people can have this machine at home. So that is the
amazing. And what are some of the signals that someone who thinks that they are absolutely healthy, what are some of the signals to watch out for rather than get a shock suddenly about their kidney?
Very difficult. It is very highly asymptomatic problem. Our kidney has a capacity which is 6 times more than what is needed for a normal functioning. Okay. So till its function drops to less than 15%, the person will not even get to know that there is a problem.
I see. Okay. So and you were mentioning about 130 million diabetics in our country. What is the size of the renal problem in our country?
Yeah, this is the renal problems, as we see, it is not only in our country, across the globe. 1 out of 10, have renal problem.
1 out of 10?
Yes.
Wow.
It's such a huge problem. But because of the redundancies and all built in, they don't get to know until some time. And when you talk about the symptomatic stage of this problem, which we call as the end stage renal disease, every year in India, 2.2 lakh people are added to this queue.
Okay.
Every year, 2.2 lakh people get into the end stage renal disease. As per
and you said this 2.2 lakh are added for a kidney transplant?
Yes, transplant or dialysis.
I see.
Yeah, that is the end stage renal disease, we say. So that is the numbers.
How easy or difficult is it to get dialysis in tier 2, tier 3, tier 4 cities?
There are a couple of things. One is, of course, they need a dialysis machine. Basically, equipment which is made by only few countries. There are only handful of them who make these dialysis machines. There are 2 German companies and 2 Japanese companies and 1 US company which are prominent. And then I'm happy to say that, we also have now an Indian company, that is Renalyx, which makes this machine. We are the first come up with this. And this is equipment is one part of it. It's expensive. It's all imported all the while. We make it. And that is one part. The second part is the nephrologist, the doctors who specialists, super specialists, right? They are around 1,800 nephrologists in this country.
That's all.
Just 1,000, yes. So that way you see the resources are also less. And then technicians are needed, and then you need good water. So for dialysis, we need very good RO water, which is less than 10 TDS, we say. So while our drinking water is around 500 TDS.
Correct.
Okay. So imagine less than 10 TDS we need. So we need a system which filters and also sources where you have that type of water. So these are all the various aspects which is needed to make this dialysis available at Tier 3 or at home. So we are trying to overcome that problem our technology.
And given the size of the problem in our country, how many nephrologists should we have?
It is twofold. One is that there is a need for task shifting. Nephrologists today, they are needed, whatever capacity we have, it's not even adequate to take care of the transplant programs, the limited transplant programs what we have. So and then nephrologists are very much, transplant is a very complex process. So that is the thing. When it comes to the dialysis and all that, we need at least, another 20 times more number of nephrologists.
Wow. Amazing.
So what we are talking about is creating telenephrology, through which, the doctor can actually take care of this from wherever they are. And there is also a intelligence or the smartness put into the system so that, even a technician can manage most of the day-to-day things. And once in a month, the nephrologist will review what's happening on telenephrology.
Okay, very interesting. So when I was reading about you, you also have what you call your Reach, Care and Treat plan.
Right.
Tell me a little bit about this plan.
Yes, Reach is how you reach out to the people at the right time, at the right place and all that. That is what we do with our early detection kit, what I was telling you, the mobile app. So Reach is the one which will help people to do the check and detect the problem at the early stage. And also whether there is problem or no problem, all that. Okay. So that semi-quantitative test I was mentioning. Care is the one which will allow them to manage the disease themselves. Because we're talking about self-management today. Because all the non-communicable diseases, it's impossible for any healthcare system to take care of every individual. Because the numbers are so large. And the cost is also going to be high. We have to go and meet a doctor for a simple checkup. It's going to be again. So self-management. And that is what, we have put into this care app. Then treatment. As I was telling you, the treatment is the one, which is needed for people who are at the end stage, And for them, we have the dialysis machine, which is along with the telenephrology software. And that is what, we call it as the treat.
Okay. Very interesting. So one more question relating to renal, and then we'll move to Forum Health. Like there is for heart, they say that you exercise regularly and, be careful kind of food you have. For diabetes, you say that, be careful about sugar. Is there any precaution that people need to take from maybe the time they're in their early 30s to make sure that they don't run into this problem, which they cannot even get to know?
Yeah, kidney problems and eye problems are all related to, they are all comorbidity of diabetes or hypertension.
Okay.
So because of that, they have to first take care of their diabetes or hypertension if they have, that is the most important thing. If that is managed, rest of it is almost managed.
Okay.
But then there are certain specific things where, someone has to look out for where they have a kidney problem. That is, they have to avoid high potassium food.
Okay.
Like, for example, tender coconut, fruits. Most of the fruits are very high potassium. Banana, very high potassium. So these are some things, which they have to avoid.
Okay.
So that way, for those who are actually healthy, these are something which is very good, right? But unfortunately, for those who have the kidney problem, they will have to avoid.
They have to be careful. Thank you, Dr. Rao. So let me now move to the Forus Health Private Limited.
Right.
Tell me a little bit about this, because now this is to do with eyes.
Yes. See, when I've been working in this healthcare space for a long time.
Right.
My journey started way back in late 80s when I was working for Ericsson in Sweden, in Stockholm. And from then, I've been working on digital health and digital connectivity, what advantages it offers to patients who are post-cardiac and all that. Later on, I joined Philips and I was the technical director for Philips and innovation manager. So there, we work with a lot of, much more with all these various imaging and healthcare informatics and stuff like that. One thing what I realized is that, whatever we are trying to do is all for the sick care. What is needed is preventive, and that is the only affordable care for anyone, Those days I used to tell in 2007 that is for India, that is what is needed. But now you see it is for the entire world, Prevention is better than cure. Very easily said and done.
Correct.
So when we started that this initiative, and I started to look into what are the preventive, what is there for preventive, which are the ologies for which, preventive is, we cannot cover the entire gamut, so we start with something. That is ophthalmology and dental are two ologies in healthcare, which everybody, will have to go. However healthy you may be or whatever, sometime in your life, we'll have to get this support, right? So when you see that in India, we have more than around 200 million people, who need some or the other form of eye care, and hardly 10% of them are getting it. So that was my one. I said, yes, that is the case. Why we should do something about it. And that's how I started this company called Forus. I left my very comfortable job with Philips, and in 2010, I started this company along with another good friend of mine who took care of the marketing part. And Forus, as the name says, it is health for us, for me and my community. So first we started with ophthalmology, and here it was more promoting preventive care again. And we made these medical devices which actually are used for people to check their eyes, and also, at the rural area. So that was the motivation.
Very interesting. And you also say that you want to eradicate avoidable blindness.
Right.
For my viewers and listeners, tell me, what is the meaning of avoidable blindness?
This is what I learned from my guru, Dr. Venkateswamy, who started Arvind Eye Hospital. I had the good fortune of spending some time with him. Over the weekend, I used to go, and he was generous enough to give a lot of time. And he used to tell this avoidable blindness. And that I latched on to that. I really like that concept. What he says is that 80% of all the problems, it is maybe ophthalmology. He used to talk about eye care, but I generalize it to everything. 80% of it is avoidable, actually. If you can detect it at the right time, it can be cured.
Correct.
Because in early stages, fixing it is very easy. I would say even diabetes, for that matter, if we detect it at the pre-diabetic stage, and if the person takes it seriously and there is intervention, it can be cured. Correct. It can be reversed or whatever, people are talking about a lot of reversing, but what I would say is it can be avoided. So that is the thing. So that is what I mean. When it applies to eye care, it is an avoidable blindness.
Very nice. Very nice. Dr. Rao, on that note, thank you so much for speaking to me. Thank you for talking to me at such length about Renalyx and the amazing work you are doing there, not just with equipment, but also to help manage the severe problem that a lot of people in India can have. And thank you for talking to me about Forus Health Private Limited. I think you're doing amazing work in both these areas. And thank you so much.
Thank you.
Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.